Duolingo, and I'm here to talk about the different kind of medications that we as EMT use, um, the routes, their indications, and just the whole medication and all. So we start with nitroglycerin, one of the most common, mostly used for chest pain, right? So a patient having chest pain, we consider using nitroglycerin. It is given by mouth, you understand? So nitroglycerin is coming in a tablet form as well as it coming in sprays. The spray, sometimes you can spray it underneath your tongue. The tablet, you put it underneath your tongue. So both of them are by mouth. We call that cross. Understand? The dosage feed at 0.3 to 0.4 milligram. You understand? Side effects of that, it might cause nausea. You understand? Burning underneath the tongue. Because you know you spray the nitrogen, the spray underneath the tongue. So it might cause all of them things. One main thing we must always remember, giving nitroglycerin, right? Nitroglycerin, you don't give it to persons who have who you suspect of Viagra or any erectile dysfunction. You understand? So that's it for nitroglycerin. We move on to activated charcoal. We give this now. So first thing, as we think about activated charcoal, think about poisoning, right? So the type of poisoning we are talking about is by mouth, right? Whether it be overdose, whether you understand, stuff like that. So the type of things now we give activated charcoal again by mouth per us. Same thing. 1 to 2 kilograms, and that's it. Side effect, most of the drugs them cause nausea and vomiting. Understand? So that's it for nitroglycerin. Which other one? Now to aspirin. Alright, aspirin now. Aspirin I will use for chest pain again. Right? If you have chest pain, you use aspirin. Right? Aspirin prevent. It's kind of like a blood thinner. So it prevents the blood from clot. It prevents clotting. It's kind of like it bursts up a clotting. So it prevents clotting from going on. So you see persons who have anticoagulant, who are on anticoagulant medication, that it bursts up. You get me? Them type of person, you only give aspirin. Aspirin now, you give it a dosage of 160 mg to 325 mg. Let me see again. Aspirin, same thing, nausea and vomiting. Understand? So we move on to which other medication. So how much? We got 2, 3 we got, right? Alright. You see, oxygen. We have got oxygen. Oxygen, we give oxygen to persons who is suffering from hypoxia. Hypoxia mean them not get enough oxygen, or you understand? They need oxygen. So we give it to them. Persons who want to give oxygen to are COPD patients. Understand? That are one of the contraindications. So that are the only type of person we sure wouldn't give oxygen to. Right? Oxygen, it is given by inhalation. Understand? Yeah, that's a route. Inhalation. We're going to move on to the next one. And again, we use a monitoring device to check the level of oxygen in our patient and know at what rate we give the patient depending on their rate. So, alright. So we move on to epinephrine. Epinephrine is used when you have a patient having an allergic reaction. So you see the allergic reaction, it might come from bees sting, say a scorpion, something. It can be something in the atmosphere. You understand? Once you have an allergic reaction to it, it is given what you call IM. We call that intramuscular. You understand? In the muscle. You understand? It is given to adult 0.3, you understand, mg and milligram, and to pediatric now at 0.50. You understand? Person's side effect of that would have been hypotension and tachycardia, because them are go understand, anxiety, stuff like that. So would have moved to let see which other one we're gonna talk about now. Which other one glucose. Yeah, we're gonna talk about glucose. Glucose now, we give that only to patients who are conscious, who can maneuver their own airway, because we don't give it to unconscious patients, right? We give it by mouth again. Same term, per os, meaning by mouth. Half to 1 tube, right? Why we give glucose? If somebody has a low sugar level, blood glucose level, hypoglycemia, which means low glycemia. You understand? That would be one of the reasons why we don't give a person glucose. Again, contraindication of it include vomiting and side effect, same nausea. Most of the medication, you have nausea. Person is suffering from nausea. So that would be my presentation on 6 of the medications that I've read on. Thank you.